letting us come back here and talk to you every year. Mixon and Associates, we are the state lobbying team for the Florida Mental Health Counselors Association. And thank you all for being here. I think that coming to these meetings and being a member of your local and state and federal associations the most important thing you can do. So we respect your profession, and we work hard to try to advocate for you every year. We've been with you guys for, I think, about 6.5 years now, and truly we've seen a lot of change, and we've got a great legislative committee on board right now with Richard and Lori and others that have been recognized. I want to start by talking to you guys about some issues that are a little broader than just what we deal with at the state level, because I think that's important. The first is, right now, the AMCA Association, the National Association, is looking at the issue of Medicare. And they've probably reached out to you. I don't know who all is informed on the issue and not. But I want to give just a moment to let you know that advocating for that in whatever way that you're asked and being knowledgeable about the topic is one of the most important things you can do, okay? So just go ahead and get engaged. All right, a couple other statewide issues that we wanted to notify you about that are, again, a little more big picture than just looking at the bills that we're working on. And one is medical marijuana. There was a bill passed last year, a bipartisan effort that is about something called Charlotte's Web. It's a low THC cannabis. It means it's high in something called CBD. So unless you were asleep for the entire year, you were hearing a lot of conversation about this. That bill did pass, okay? It is in the process of being reformed at Rule, and Robin McKenzie could, of course, and other folks that work in the Department of Health and for the boards can tell you a lot about that. Right now, that's at the Board of Medicine or at the Compassionate Use Care Committee, and they are looking at how to implement that bill. In the meantime, of course, there was a statewide amendment, that ballot measure that failed. It failed at 58%. Here in Florida, you have to have 60%. And that didn't pass. We're back this year, and we've got folks like Jeff Brandis, who is in Pinellas County, who's looking at expanding what that can do. So this is important because it's part of a conversation of access to care. You're going to hear me say that a lot today. This is about a contingent of people who are receiving care from cannabis and who are responding well to that. And so a legislature that typically is gridlocked on issues like controlled substances, of course, is coming back and looking at this and saying, okay, we're going to modernize. We're going to consider this. And in a bipartisan effort, they are moving forward with that. So again, just think that's worth mentioning. And another brief topic, everyone's probably wondering what's going on with Medicaid expansion. To be frank, the Senate is absolutely in support. The governor's indicated he may be in support. You have to have all three. The House is split. And we thought until somewhat recently that the House Speaker would be interested in going ahead and expanding Medicaid. However, it's looking now, as of just a couple weeks ago, he's made some pretty strong statements that, and that's Steve Crisafulli, Speaker Crisafulli from Brevard County, that he will not be looking at Medicaid expansion. Okay, so we're not expecting that to probably pass this year, although it is very possible. We can't really prognosticate about that at this time. All right, so let's get down to the nitty-gritty of what's really going on in the committees where we sit and listen to statewide policy every day, okay? And you're going to hear this term a lot. It's access to care, all right? And what has happened is that here in the state of Florida, we have medically underserved regions and areas where insured folks and uninsured folks are not receiving care, okay? And that's for a number of reasons. But the first thing I want to talk about is I get a little bit of pushback on this, which is interesting. But For a long time, when I first started lobbying, and our firm first started lobbying for this association, every couple of years, a member of the House and Senate would come out with a bill, and they'd refer to it as mental health parity. Is anyone familiar with that term? Know what that means, right? It's mental health care is health care, okay? Like, this is physiological, psychological, whatever you want to call it. It's the whole person. So for years and years and years, I would think that this association and others probably felt favorably toward that idea. You're licensed on a board that's under the Department of Health. I mean, for all purposes, you're part of a solution to a problem that we currently have here in the state of Florida. And that's that there are not enough people to take care of an aging population, okay? And so a lot of the bills that we see coming through the House and Senate right now, and again, we're really just discussing statewide policy, it's very critical, are dealing with that healthcare shortage. How do people get access to care? So one of the ways that the state is looking at that is through the function of telehealth, okay? Telehealth is a little bit controversial, I think, from a practitioner level, and some of that is for obvious reasons, and others are a little more about evolution and modernization. And so what happens is the state of Florida thinks it appropriate that practitioners licensed under the Department of Health have high-level equipment that can serve the purpose of connecting people, let's say a doctor or a nurse or a mental health provider, to patients that need care, especially patients that don't find it easy to access that treatment, whatever it may be. So through the use of high-level equipment that has certain specifications that need to be met, people can communicate with their provider through what we call an encounter. Okay, that's how they refer to it. And that's always been the case, you know, for the past few years. This has been growing and growing. The difference is that the state would like, and some of the lawmakers would like to ensure that telehealth is treated like health. And that means that if providers of insurance are going to say, okay, this procedure or this mechanism for diagnosing and treating, we would like to see that occur through telehealth, and we would like for you to have to reimburse that, because if you're saying that your equipment can communicate between a person and a provider, and that can be a real encounter, a real engagement, just like being person to person, then that should be reimbursed. Now, the state's not price fixing that. They're not saying, you know, at least in this one bill, they're not price fixing that. And so this all sounds okay, all right? Except for that last year, the bill that initially came out in the Senate would have, or that was debated in the Senate, rather, would have recognized one provider group, okay? And those are physicians, well, two, because osteopathic and allopathic physicians. Nothing wrong with that model, nothing wrong with the fact that, of course, physicians should communicate with patients via telemedicine, except for that doesn't actually look like medicine, right? Because what about all of the people out there that need mental health treatment or need to communicate with their physical therapist for the issue that the pain that they're still having in their leg, and they live in a rural area and they cannot make it. So we came in last year, FMHCA and your lobby corps, and we spoke with the senators and the representatives, and thankfully in the Senate we did amend a bill at one time that would have included you as healthcare practitioners. The House always had you in their package, okay? But we got the bill back this year and spoke with Senator Bean, who's the chairman of the Healthcare Committee, and with the chair of the House Committee, and thankfully they've got coverage for mental health providers such as you included in that package, okay? So that is your lobbying team at work, your board of directors at work, and that's what happens when you are in Tallahassee paying attention to these issues. Sometimes you want to support proactively issues that are good for everyone, not just for your own function of the healthcare market. And so we'll be asking you as members and hopefully non-members that will become members to engage your legislators supporting those efforts. And you'll get emails from FMHCA about that in the near future. And I do want to mention this a bit, because I know that the content of interacting with a person over telecommunication or over camera is maybe a little uncomfortable. And that's a lot of kind of what I want to shake up with you guys, is that healthcare is changing. I mean, it has already changed. And in that tremendous amount of evolution, the legislature is looking at how can government get out of your way and allow people to practice efficiently to reach the healthcare market that's out there. And so the study that was done by the Department of Veterans Affairs that I'm referencing here, it may not be the broadest or the best study, but for the naysayers out there, for people that don't believe that telemedicine encounters can matter, this group of veterans living in a rural area in Virginia was 8 times as likely to finish all of their clinical sessions if they received those via telemedicine, okay? Than the people who had the in-person encounters, who had to make the drive and, hold their heads high as they walked in the door to go meet with somebody. I happen to think that that's powerful. I think it's real. And I think it's a good example of what's happening in telemedicine. I know it's scary, but it's the future, so. Another area that is a little more specific to mental health counselors in the state right now is you're going to see a lot of Baker Act related legislation. Aaron, thankfully, was kind enough right before I got up here to look up the date that you all got accepted to submit somebody for an involuntary examination. That wasn't always the case, and it was, what did we say, back in 2006. It was implemented in July of 2006, so you guys successfully lobbied for that back in the session of 2006 or 2005, depending on when it was, how they implemented it. But we're back looking at the Baker Act again. And here's why. And you'll hear me, those of you that had to have dinner with me last night, have to hear this a couple of times, but people are sick, okay? And they can't get to treatment, and part of that is mental health treatment. And what's happening is that people are going without care, and they're ending up in hospitals. And the state and the state's safety nets, we cannot continue to pick up a bill for people who shouldn't be in hospitals. They should have gotten care ahead of time. And you are absolutely part of the solution for that, okay? If you don't think that the state is taking seriously the fact that you're part of the solution for that, then you don't understand how valuable your profession is. All right, so 2 things are happening. There are people ending up in hospitals that shouldn't be there because they don't have access to mental health treatment. And people are losing their minds, being investigated, and dropping their children off of bridges into the bay, okay? This is what the people of Florida are seeing right now. These are the stories you're hearing, so there is a heavy focus on the Department of Children and Families. Now, of course, you're licensed under DOH, or if you're a student, you'll be licensed, or if you're a registered intern, you're registered, but the cross-section of DCF and DOH issues are always there. And so you're going to be hearing a lot this year about the revolving door of the Baker Act function and what we do about it. This is why it is important to be a member of an association like this. There is a bill right now by Senator Joe Abruzzo, who's a highly valued Democrat from South Florida, and Lori Berman, who's a more recent elected official in the House. And those bills are going to create a committee to study 7 very specific areas around the Baker Act function. Okay, so this is a function that I would say far and away you deserve the ability and have the professional credentials to determine if someone is a harm to himself or another. But you just got that right in our statute, several years ago, ultimately. We're already back there, and we're looking at what to do next. And so among all of these bills, they're going to create a committee. I think there are 22 people on it, and your profession is not one of them, okay? These are the folks that are going to be on that committee. And, you know, among them, you've got hospital board folks, you've got a judge that maybe has been around cases like this or looked at cases like this. If I could have had all the text on here, the way the bill actually reads is 2 physicians appointed by the Florida Medical Association, 1 psychiatrist appointed by, of course, the State Association of Psychiatry, 1 psychologist by the Florida Academy of Psychology, whatever their formal term is. And what we hope it will say come next meeting, and what has been submitted, and what I think we have sign up for, is that it will say a licensed mental health counselor is appointed by the Florida Mental Health Counselors Association. And we're not there yet. We had some folks email these members yesterday saying, you know, please support this, it's important, but I've been assured that there's a good chance we will be at the table on this. And so we'll update you, of course, as we go. But that is the value of making sure you're a member of something like this, because this committee is not only looking at how many days, how many hours, with 72 hours now that when somebody, before you have to release them, they're looking at the length of time for that. They're looking at if AR&Ps should be able to rescind the Baker Act. Sounds like a lot of liability to me, but these are the topics they're going to be covering. It's extremely important. So let's get somebody included on that. And when it's time, I would very much like your support, as with this association, to write your legislators and tell them how incredibly important it is to have a functional and engaged profession at the table on this board. How they write their legislators? If you have passed by the sign outside at all, a number of you I see in the room did engage your legislators at this meeting by visiting flsenate.com and myfloridahouse.gov. Those are the 2. You can just Google it if you'd like. All you click on is Find My Legislator. It allows you to access all of their information. And I'll talk in just a minute about how I think the best way is to go about that. Okay, so this academy, in addition to these very available issues that we can see and feel every day, issues like the Baker Act and telemedicine, where we're currently having to advocate so that we're at the table and not on the menu, which is our favorite term. In addition to those issues, there's also a shift in healthcare that I want to try to describe to you. And I'm not the best at it, but I think it's important to recognize. And that is that, you know, healthcare delivery is changing. If you don't think that there was a time that members of the Florida Medical Association and doctors were terrified by the idea of people receiving treatment for non-malignant pain at a CVS Caremark or a Sam's Club, you are wrong. We were all scared of that. You know, I mean, this was a very real fear for a lot of people. You know why? Because they have enormous student loans. You know, practitioners like yourselves go to school and you are qualified and you work hard for years and years and years, and then you put in more time and you intern and your practicum is exhausting, and then you get there and you want to be at the highest step of the highest realm of delivery of the type of care you offer, okay? And then what happens is somebody comes up behind you and they are every step behind. They are seeking and seeking and seeking. They are modernizing and modernizing and modernizing. And we call it the healthcare steps. I'll show you a picture in a second. But if you are not continually seeking to be part of a solution, you fall right off the top, okay? And so yes, there was a time when patients and doctors and state departments and boards were terrified of people receiving any sort of care in a non-traditional fashion. Not in private practice, not in a hospital, no way. And that's not where we are anymore, okay? We are in a place where we're in a market-driven economy when it comes to healthcare right now, okay? And that means folks are going to be delivered care in the way that works best for them, mental health included, all right? And so, and y'all are gonna be mad at me about this, I promise, but when you're sitting there and you're thinking about private practice and you know, wanting to protect that professional standard and how decent the pay can be and how you worked hard in a community mental health center for years, saying sad, sad things every day, and you finally made it to a point where you can be in your comfortable office and have somebody come in and charge you $55 to $150 a day, whatever it may be, for their treatment, that will never go away. You'll always have the opportunity to do that, but I'm telling you those opportunities are less and less and less and less, because there are people who want to come in and they want to do it cheaper and more efficiently and with equally good outcomes. Now, do we have documented evidence that those interactions are as good, whether they be a different type of provider coming in and saying that they can clinically, you know, examine somebody and maybe and do some sort of analysis on them? And we don't have all the data yet. But I can tell you the people that were scared in the other states that modernized, we don't have data saying that that was a bad thing either. And so what's happening is people are being delivered care as quickly as possible, and it will not surprise me one bit if in states like Florida, down the road, you have somebody at a Walmart clinic with a physician assistant or ARNP, probably an ARNP, advanced registered nurse practitioner, sitting next door to a licensed mental health professional, sitting next door to an optometrist, okay? Billing the whole 9 yards right there together, okay? Because in the minds of the legislators and in the minds of the people that are on the staff for those legislators, and they may not be right, but we don't have data saying they're not, that is a safe way to deliver care. And it's an efficient way to deliver care and a cheap way to deliver care. So if you have ideas to do it better or more efficiently, then you have got to share those. If you think that that is a joke and you have personal stories about how important it was that you were sitting right next to that client in the moment that changed their life forever, if you have stories about somebody that was Baker acted in that revolving door over and over, and then after a term of your care wasn't in that revolving door anymore, those are powerful. But until they hear you, until the policymakers hear you saying that, they're going to look to do it efficiently and safely and affordably. And until there is data saying that that's not the way it's being delivered, that is their assumption. Okay? So what you've got to do is you've got to get out and talk to these people. You know, last year, for those of you that were here at the meeting, we asked that you weigh in on some things, and I know for a fact some of you have met with your legislators, you've been to Tallahassee, but you've got to do more. It is incredibly important to establish relationships. And what you've got is you've got some federal policies that are in the way. I truly believe, and I will argue this until the death, but I believe that Medicare reimbursement trickling down to Medicaid reimbursement for you all not being in that category is harmful. Harmful. And you've got to fix it. It's got to be fixed. So you've got, I'm going to challenge you to do one thing. All right, this is the only thing I'm going to say. Please, please do this. I would like for everybody out there to reach out to your state legislator and ask your state legislator to write your congressman for whom they are a constituent and tell them that it's important that licensed mental health counselors can be reimbursed by Medicare and this eventually fully by Medicaid, okay? Does everyone think they can spend 10 minutes to write that kind of an email? Okay. I think somebody in the room wrote that email last night, right? There we go. So reach out to your state level legislator or your county commissioner if you know that person even better and say, I would like for you to reach out to your congressman, your senator for whom you are a constituent, and tell them that the people of Florida could be better off if mental health counselors were fully reimbursed under the most simple of safety nets in the healthcare realm for the public and the good of the United States of America. So please, 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 please do that. And most of all, session begins in March. It'll be over right around, what's that, March 3rd. Richard knows the date. He'll be coming up on the 10th or 11th, I think, to do some advocating. But when the session is over, the legislators will head back to their districts. The most effective way to share about your profession is to set up a meeting in the district where policy is not flooding in and out constantly, and go meet with your senator or representative from your local area and tell them about yourself. You do not have to come in with a million issues that you want to share with them. You simply need to tell them how you're educated, where you work, if you're reimbursed and how. Make them knowledgeable. And if they already know, stop talking about that and talk about something else. You know, talk about issues that you might not be, is anybody who's a student in here? Or even in faculty doing research? I would love to read, probably not thoroughly, because I'll just read the overview, but some interesting research from this group that you can be proud of on the social psychology of pertinent issues right now, which are shared economy like Uber and Airbnb and Feasty. And I'll give you Feasty as an example. And this is how you excite legislators if they're bored listening to you talk about your profession. You say, you know, I know that right now the legislature and the federal government are considering a lot of issues about shared economy. You know, I hear that term a lot. You know, and to me that means like it's a trust-based system of living. You know, I don't have a lawnmower, so I'm going to go on this website. The guy down the street's got a lawnmower. Well, looky there. I didn't have to pay for this. And we're friends now. And we're going back to a trust-based system. I think that's interesting. Well, Feasty is a website where you go online and you say, I want Italian for dinner on Wednesday, but I can't cook an 8-hour sauce. And so you find a person in your community who's going to be making dinner anyway. And they say, I'm going to invite 10 of you over. So you sign yourself up, you bring the wine, you go over there, and you have dinner, and you meet people at the table, and you sit there and eat. When you're done, you paid $20 or whatever it may be. Feasty, the website, gets a small portion of that, of course. Out of that small portion, which may seem just like a nice, you know, social event, there's $1 million insurance policy. All right, on every single dinner that occurs on that website. This is real policy. Legislators are trying to figure out how to handle a system of society that's going back to trust-based values and family. And if you can interest legislators, not just in your policy, but in how exciting your profession is, and start thinking about mental health as part of a healthcare system that needs your help, because in Florida we have a major access to care problem that cannot be filled with doctors, then you are having a conversation. Then you are meeting the people that need to hear from you. And they will love it. But if you are not in that discussion, you will get left behind. Okay? You will get left behind. So make sure that you're there. Reach out to these people. We've got flyers outside on the table that explain, you know, a lot of these issues. Talk to us about what's getting in your way. Be a part of progress. And let FMHCA know what we can do to help.